Hi, we are discussing treatment options for fibroid uterus. I'm Dr. Deepti Asthana, Senior Gynecologist in Fortis Hospital, Gurgaon and Director of Colossa Clinic. This video is in continuation of our previous video series about the fibroids. Now in this video, we'll talk about the treatment part of the fibroids. You can subscribe my channel Colossa Gyne for more updates about female reproductive health. Now, as we have already discussed, uterine fibroids are fibrous, solid, non-cancerous tumors of the uterus. They're also known as uterine leiomyomas or myomas. Now, good thing about fibroid is that they're 100% treatable, but treatment options depend if you're symptomatic, your age, your fertility status, and size and site and number of fibroids. Now, if you're diagnosed with small to moderate uterine fibroids and have no symptoms, there might not be any need for treatment. Your doctor may simply monitor their growth at your annual examination or more frequently if needed. Also, if you're nearing the menopause and if the fibroid size is small, we usually wait, as after menopause, the fibroids shrink on their own. Now, your doctor may recommend treatment if you have fibroid-related heavy menstrual period bleeding, pain or pressure that interferes with your daily life and affects your quality of life. Or if you're trying to get pregnant and the fibroids are located in the area that may impact getting or staying pregnant, then you need removal. Not all fibroids need removal in infertility patients. Only those fibroids who are indenting the endometrium of the uterus and distorting the cavity need removal. If not removed, females may have difficulty in conception, they may have recurrent abortions, they have tendency to go in preterm labor, have growth retarded babies, etc. They may also have difficulty in normal vaginal deliveries and may need to go for cesarean sections. Now coming to the treatment option, coming to the medications first, this is usually the temporary form of treatment for uterine fibroids. This is used to regulate hormone levels so as to reduce the severity of symptoms caused by the fibroids. Now, medications cannot reduce the size of the fibroid permanently. They're just used to buy time for surgery till one prepares mentally for the surgical procedure, builds up the hemoglobin, and also for those patients who are not suitable for surgery because of some medical reason. Fibroid size may reduce 30 to 40%, but it does grow back once medicines are stopped. Now, the most commonly used agents are gonadotropin releasing hormone analogs and selective progesterone receptor modulators. Alternatively, other medicines used are levonorgestrel intrauterine device, which we popularly call as Mirena, combined or oral contraceptive pills, progesterones, aromatase inhibitors, androgenic agents, and hemostats like tranexamic acids. Get in touch with your doctor for more information about them. Now coming to non-invasive treatment methods, first we'll talk about uterine fibroid embolization, UFE. Now, UFE shrinks fibroids by blocking some of the blood supply to the uterus. It can decrease symptoms of pressure and bleeding. It is indicated for the treatment of symptomatic uterine fibroids in women who do not wish future fertility but want to avoid surgical procedures or have contraindications to surgery. Active contraindications are pregnancy, active uterine infection, and gynecological malignancies. Relative contraindications are contrast material allergies, coagulopathies, and renal failure. Now it is performed by an intervention radiologist. After the procedure, with the blood supply blocked, fibroids do shrink by about 30 to 50%. Now this procedure preserves your uterus, but it is not approved by FDA for women who want to get pregnant. Some patients begin menopause after UFE, especially if they are older than 45. Recovery usually takes 1 to 2 weeks, and most patients return to full activity at 2 weeks. New fibroids can begin to grow after the procedure. About 15 to 20% of patients in their second procedure or surgery for their fibroids 5 years after the initial treatment if they have not yet reached menopause. Now coming to the next treatment, we have MRI guided focused ultrasound. Now this is a recent non-invasive approach in the management of uterine fibroids. Here, mechanical energy is carried by high intensity ultrasound beams originating from a source outside the patient and focusing on an internal target volume without any need for skin cuts or invasive interventions. Now the interaction between ultrasound waves and biological tissues induces heating and coagulative necrosis of cells, determining a selective thermal ablation of target lesions. Now, concomitantly, real-time control with MRI thermometric map ensures a complete and effective treatment and the sparing of surrounding healthy tissues from any potentially unwanted damage. Now, use of this has been approved by FDA in 2004. Inclusion criteria include women in whom dominant fibroids have been diagnosed and that are compatible with the clinical presentations, females who have a desire for future pregnancies, and fibroids with MRI features compatible with this treatment are those which are solitary and with diameter less than 10 cm. Now, absolute contraindications to this procedure includes positive pregnancy test, general contraindications to MRI, poor renal function, anemia, body weight greater than 115 kgs, and any concomitant pathologies such as rectal cancer, ovarian cancer, etc. Now, coming to invasive surgical methods, first is myomectomy. Now, in simple terms, myomectomy is removal of the fibroids while keeping uterus in place. Now, myomectomy may reduce both bleeding and the pressure symptoms. Now, the goal of myomectomy is to keep the uterus for future fertility. It does impact the type of delivery that is recommended, and your doctor may recommend an elective cesarean if you have had a myomectomy in the past. Now, there are several different ways to perform a myomectomy. It could be through a laparoscope, it could be robotic, or through a larger abdominal incision. The best way depends on where your fibroids are located and how big they are and how many you have. If it is a submucous fibroid, your doctor may prefer doing myomectomy through a hysteroscope. Now, if it is a very large fibroid reaching up to your belly button and there are multiple fibroids or broad ligament fibroid or a cervical fibroid, your doctor may prefer going for an open surgery. Now, remember, new fibroids can grow back after surgery, though not always. Now, between 10% to 25% of patients who undergo myomectomy will need a second fibroid surgery during their reproductive years, and the timing of repeat surgeries varies. Now, coming to the final treatment is the hysterectomy. Hysterectomy means surgical procedure to remove the uterus. Now, this is a permanent treatment because it removes the uterus as well as the fibroids, and a patient cannot go into fertility part after uterus removal. This is usually advised when you're nearing perimenopause. Now, hysterectomy may be performed through laparoscope or a robotic, or it is an open one if you have a large uterus and the fibroid is too big. Now, recovery varies based on the type of the procedure performed, but most patients return to work at 4 weeks and all regular activities post 8 weeks. Now, that's all in this video. Subscribe my channel Closer Gynae for more videos. You can log into my website drdiptiasthana.com and closeresthetic.com, or follow me on Instagram. Take home messages. Any change in your menstrual pattern should not be ignored. Go for a simple ultrasound to rule out fibroids and meet your doctor to make a treatment plan as per your needs. Thank you and stay healthy.